Hello, my name is Alicia. I'm going to be your nurse today. I'm going to be doing a physical assessment on you. Just going to wash my hands real quick. I'm going to be sure to lather up, wash in between my hands and my fingers, underneath my nails. I'm going to do this for a full 15 seconds. Then I'm going to go ahead and take one paper towel and dry in a patting motion, circular, from my fingertips down to my wrists. Then I'm going to take another paper towel and I'm going to do the same, dry in a circular motion from my fingertips down to my wrists. Then I'm going to take two more paper towels. I'm going to use these to close the faucet. Like I said, my name's Alicia. I'm here to do your physical assessment. Let me just provide you with some privacy. And can you give me your name and date of birth, please?
Shana Diggs, 51091.
Okay, and do you know where you are?
Lincoln Nursing Home.
Okay, and do you know the president's name?
Trump.
Trump, and what year are we in?
2018.
Perfect, perfect. And are you feeling any pain today, Shana?
Yes, in my head.
In your head? And how does it feel?
It's like a throbbing pain.
Like a throbbing pain, okay. And does it radiate anywhere?
Just from like the top of my eye to the back of my head.
Okay, and on a scale of 0 to 10, how would you say your pain is at?
Say an 8 right now.
An 8, okay. And your pain, is it alleviated by anything?
I took some Tylenol,
So you took some Tylenol for it and that alleviated
like 20
it?
minutes ago.
Does anything make it feel worse?
Light.
Light, okay. And how long has this been happening?
About 2 days.
About 2 days, okay. And does it come and go or is it constant?
It's been constant.
Okay, I'll make a note of that. So Shana, what I'm gonna do for you is that when I do your physical assessment, I do have to touch you. Is that okay with you?
Yeah.
Okay, so first what I'm gonna do is I'm gonna touch your head. I'm gonna inspect, I'm gonna look for any lesions, any bumps. I'll look to see if there's any infestations as well. There's no lesions or bumps present, no infestation. I'm gonna move to your ears. I'm gonna look behind your ears. I'm gonna see if there's any tearing or breakdown, any signs of any pressure ulcers as well. Looks good. Then I'm gonna move to your neck. I'm gonna check your lymph nodes. I'm gonna look for any signs of infection, any swelling. Everything looks good, okay. And Shana, can you do me a favor? Can you just raise your eyebrows for me? Perfect. Can you smile, frown, puff out your cheeks? Perfect, your face looks symmetrical. And why don't you, while I'm here, can you just check your nose? Can you just, breathe in, out, other side? Any signs of occlusion? Perfect. Now, have you felt any sinus problems? You said you had a headache as well. Okay. And do you feel any dizziness?
A little bit.
A little bit, okay. And how about your vision? Has it been blurred at all?
Yes, I wear glasses.
You wear glasses. Okay, perfect. So let me go ahead and take a look at your eyes now. Let's get this one. It's a new light. All right, so what I want you to do is I want you to look at my nose and just follow my eye with the light, okay? And the light in the room is dim as well, and they do react well to light. So now what I want you to do is I want you to follow my pen light, but please do not move your head, okay? Just your eyes. Perfect. And again. Great, so they do accommodate as well, and the pupils are reactive to light, and they are round and equal. Now can you open your mouth for me, please? All right, checking in your mouth. Can you move your tongue around for me? Good. Membranes are intact. They are moist. Perfect. Can I look inside of your nose? Any drainage? Have you had any runny noses? No? Okay. And again, the membranes are intact. Now I'm going to go ahead and take a look in your ears. I'm going to be sure to pull it up and back. We'll look inside. The tympanic membrane is pearly white. No signs of infection. Again, up and back. And it is pearly white, no signs of infection. Perfect. I'm going to take a look at your trachea. Can you just swallow for me, please? All right, it is in line. Great. Take a look at your carotid pulse. I'm going to check it. Great. Present. Present as well. I'm going to go ahead and listen to the carotid pulse as well. And I'm going to listen with the bell side of the stethoscope. I'm listening for any bruise, And there are no buoys present. Great. Now, Shayna, can you do me a favor and move your shoulders up and down, flex your elbows, great. Your wrists, roll them. Good, good. Let me see your hands, please. What I'm gonna do is I'm gonna check each of your brachial pulses. This way I can see if they are equal, bounding, yes. And then I'm going to check your radial. Equal and bounding. Great. With your hands, I'm gonna check your cap refill. Make sure it's under 3 seconds. Good. Good circulation to the fingers. Let me just check your skin now, see if there's any tears, any breakdown, any bruising. Have you seen any bruising on your body recently? Okay. I don't see any scarring or bruising. I don't feel any crackles. Perfect. Now I'm gonna take a look into your breathing. I'm gonna listen to your breath sounds. Every time you feel the stethoscope, just take a deep breath in, okay? I'm gonna switch the side of the bell to the stethoscope. Go ahead, take a deep breath in, please. Perfect. Breath in. Great. Good. Can you do me a favor and lift your breast for me, please? Thank you. Listen to the bottom of the lungs. And the lungs are clear, there is no sign of pneumonia. Now what I'm gonna do is I'm gonna listen to the back of your lungs as well. Okay. And just like before, every time you feel the stethoscope, just take a deep breath in, okay? Have you felt any lightheadedness or dizziness? Any cough or short of breath?
No.
Okay, perfect. And now what I'm gonna do is I'm gonna take a look at a hearing of your heart sounds, okay? And this time I'm gonna use the bell of the stethoscope. And I'm gonna listen to the aortic first. Then the mitral, the pulmonic. Then at Erb's point. And can you lift your breast for me, please? Then I'm gonna listen to the tricuspid. And then the mitral, which is the apical pulse. So I'm gonna make sure to listen to it for a full minute. Good, thank you. Can you do me a favor and lie down, please? All right, so first what I'm gonna do is I'm going to assess for any jugular vein distension. There's no distension present. Then I'm gonna inspect your abdomen. I'm gonna look for any signs of distension as well. The abdomen appears flat, doesn't appear to be any bruising, any scarring, any open areas. And now, have you felt any constipation lately, diarrhea?
No.
Okay, and how have your bowel movements been?
Normal.
Normal. When was the last bowel movement?
Last night.
Okay, and what was the stool look like?
Light brown.
Light brown, and what was it? Was it soft?
Yeah.
It was normal. Okay, and how about your last void?
Before my doctor's appointment.
Before your doctor's appointment. Good. And did you feel any burning sensation, any pain in your urination?
No, it was all normal.
And what was the color of your urine then?
Yellow.
Yellow. Okay, perfect. So now I'm gonna go ahead and take a listen to your bowel sounds. And I'm gonna switch the end of my stethoscope. And I'm gonna listen to the right lower quadrant first. Then the right upper quadrant. Then the left upper quadrant. and then the left lower quadrant. Bowel sounds are within normal limits. Now I'm gonna palpate. If you feel any tenderness or pain, let me know, okay? All right. Abdomen is soft. Any tenderness felt? Okay, great. You can go ahead and sit up now. Okay. Now what I want you to do is I want you to squeeze my hands really tight. Let me see those muscles. Perfect. Okay. Push up on my hands. Push down on my hands. Can you push against my feet? Up. Up. One foot up, please. Other foot up, please. Perfect. And can you push against me? Great, great. And now what I'm gonna do is I'm gonna try to check for any signs of edema. Have you noticed any swelling in your legs after you walk?
No.
No? Okay. And while I'm checking for the edema, I'm also gonna check for your pedal pulse and also your posterior tibial. Okay. Doesn't look like there's any signs of edema on each leg. Perfect. I'm gonna check your pedal pulse on each side. I'm sorry. Pedal pulse on each side. I'm gonna check your posterior tibial. Then I'm gonna check your cap refills, and on all your toes, make sure that your circulation is correct. Perfect. You can do me a favor and stand up and walk. I just wanna make sure that you walk properly. And let me know if there's any pain or discomfort in your walk.
No.
Gait looks normal. Perfect. Okay, well that is the end of our exam. I appreciate it. Thank you very much.